Hi everyone. I think we're going to make a start because it's only an hour and we've got three presentations to do. So it's fantastic to see so many people online today. So welcome to the Unit Costs of Health and Social Care webinar. For people who do not know me, I'm Karen Jones. I'm the Director of the Personal Social Services Research Unit at the University of Kent, and I'm the Principal Investigator for the Unit Cost Programme. So we have the full team is online. We've got Helen Weatherly from the University of York, who is the co-lead of the programme, who will be presenting today alongside Minyu from the University of York, who led the development of the unit cost adjuster. Next slide, please. So this is the usual disclaimer. So the views expressed in this webinar are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. Next slide, please. So the plan for this webinar, we have three presentations lasting 30 minutes, which will be recorded, and then we go on to question and answers. So we'll only answer questions during the Q&A session, so please add your questions to the chat and the team will post them on the whiteboard. If we don't have time to answer your question, we will add responses onto our unit cost website after the webinar. So, and there will be a link for feedback. It's a feedback form at the end of the session. Next slide, please. So in terms of the agenda, we have three presentations, looking a brief overview of the unit cost programme, and then Helen will introduce the unit cost adjuster, which will be followed by Minyu, who will provide an overview and demonstration of the unit cost adjuster. And this will, the three presentations will be followed by a question and answer session. Next slide, please. So I would like to mention the very sad passing of Jules Forder last year. He was a significant team member from the developing of the initial funding proposal to publishing the first two unit cost manuals. Next slide, please. So in terms of the history of the unit cost programme, so knowing the costs of something is key to making informed decisions about what to buy or use. In many everyday situations, we rely on the label price of an item to quickly tell us what it will cost us to buy that item, but there's rarely published prices for health and social care services in the UK. So this is the motivation for calculating the annual costs of health and social care. PSSRU at the University of Kent have been producing cost estimates for delivering care services since 1992, and I would like to acknowledge my colleagues at PSSRU who led or contributed to the previous publications of the unit cost manual. Next slide, please. So what do we mean by a unit cost? cost is always related to the amount, the unit of something being brought. For care services, this could be attending a daycare session or staying for a week in a residential nursing care home. For the workforce, the unit costs will be calculated as the cost per working hour. So, for example, the cost per working hour for a social worker, a GP, a nurse. Next slide, please. So, in terms of the key principle with our estimations is to provide robust estimates based on economic theory. So what do we mean by this? So the most relevant economic cost is the long run marginal opportunity cost. So marginal costs, which is the cost of supporting one extra client or providing one additional unit of output. So the long run, the estimate assumes the change in activity is maintained into the future rather than representing a short-term investment. So the economic concept of opportunity cost considers that using resources in one way prevents their use in other ways. Next slide, please. So in 2022, we started a 5-year partnership with the Centre for Health Economics at the University of York, which goes on to until March 2027. Next slide, please. So the aim is to continue to estimate unit costs of health and social care services. However, the programme also wants to explore new methods to improve our unit cost estimations. The aim is also to explore our methodology and investigate the potential for developments in our methodology in how we estimate our unit costs. Next slide, please. So in terms of our programme team, we have 3 research advisors who are on the call today, who provide invaluable insights into to our work alongside the public involvement manager, Sarah Birch, from the University of Kent. So our advisors, their input is invaluable to the programme, as I said before, to ensure our work is accessible to everyone, ensure that our dissemination is creative, and also to be designed to capture the public's interests. Why are unit costs important to the general public? And they provide so much more. So this is just a few examples of their inputs. And so we have at the University of Kent, so we've got Sarah Birch, as I said, the public involvement manager, but also Alan Dargan, who provides all our IT support, and also Hansel, who is our economist, and then the University of York, Helen Weatherly is the co-lead for the programme. We have Adriana, Martin, Minu, and Seb. So it's 2022. It's an exciting new collaboration to bring new ideas to the programme. Next slide, please. So in terms of the work packages, we have 5 work packages. So work package 1 is very much review and scope and update, replace our cost information. Then we have work package 2 to explore how we can enhance what we offer. Work package 3 is very much around the development of our methodology in estimating unit costs. Work package 4 is around involving people who use the unit costs manual, and also the public fully in our programme, to ensure that our documents are clearly formatted, easily available and accessible. And then right at the end, work package 5 is the publication of the manual. So this webinar will focus on work package 2. So this is enhancing what we offer with the development of the unit cost adjuster. So now Helen will provide an introduction to the adjuster. So over to you, Helen.
Thank you very much, Karen. Yes, we're really happy to be able to demonstrate the new unit cost adjuster to you. Alan, could you turn to the next slide, please? Yeah, we're going to talk about how we planned it, the motivation for producing it, where it sits in the unit cost programme. And I want to offer particular thanks to Minyu, who produced the adjuster, and also to Seb Hind for his role in supervising this work. Next slide, please. You've seen a similar slide to this from Karen, but this is just, so Karen talked about the 4 objectives of the unit cost programme, and I've specifically highlighted the second objective, which is to explore new ways to enhance the offer, and the unit cost adjuster is a fundamental part of that. Next slide, please. So to tell you a little bit about the plans for enhancing the offer, so we wanted to plan the steps, and we planned to produce a unit cost adjuster that is available to all, online and free to access. And the aim is that the unit cost adjuster is includes all the unit costs that are included in the unit cost manual, which is something we make available each year on the website. We also want to make sure that the adjuster is building in user feedback to explore how best to produce and publish unit cost adjuster in a useful way. And we wanted to make the adjuster interactive and give the user the opportunity to estimate their own unit costs, and being able to override components of the unit costs with their own data. Elements of the cost can be overridden. This includes things like staff costs, training costs, capital costs, and other additional resources we use to produce the service, or the cost of the unit of the workforce, as Minyu will explain soon. So thus far, we've produced the unit cost adjuster. We've sought feedback from our research advisors, our PPIE, namely Doug, Sarah, and Debs. And we've built that feedback in, and now in sharing it with you, we're keen to build in your feedback. And then when we actually publish it online, we're going to seek further feedback. So our plan is to upload a unit cost adjuster as a draft to the unit cost website with a short registration process and a couple of questions to request user feedback. And the aim is to work towards publishing a version of the unit cost adjuster which is updated and hopefully improved every year, and providing unit costs relevant to the latest financial year. Next slide, please, Alan. So our motivation for producing the unit cost adjuster, to say a little bit more in detail about this. So we're keen to make unit costs more accessible for people who are interested in unit costs and want to use them for their own purposes, such as for use in costings, financial analysis and evaluations. We want to produce an adjuster that gives people ready access to the figures so they can explore the different components of the costs for themselves. Thirdly, and relatedly, we would like to enable people to easily adjust the costs so that they're relevant to their own setting or needs. And with this, there's an overriding component where they can include their own costs, or they can have the opportunity to omit particular components of the costs. Fourthly, to improve the efficiency and accuracy in updating the unit cost manual each year and how people use it. And finally, to think about which components people use and how, supporting us to make improvements iteratively over time in terms of what we offer and how. Next slide, please. So this next slide, it's basically got three figures, and it's just different components of the unit cost programme that are maybe the more kind of crunchy aspects. So I'll talk about each of the figures in turn, but the first one is basically the Excel file with the unit costs that has been developed over the many years that Karen talked about with her and colleagues in Kent. And then there's the public-facing unit cost manual, which is published online every year. And thirdly, and what we're specifically focusing on today, the unit cost adjuster. Next slide, please. So just to explain in a little bit more detail, figure one, I wanted to go through this just in a little bit more detail. So at present, we have a master file in Excel, which contains all the unit cost estimates. And there are 4 types of unit costs contained in the file. Firstly, newly included unit costs for new services that become available to the public. Secondly, newly included unit costs for services which may have been available for some time, but we've only just got robust data in order to estimate unit costs. And this data might be from published studies or routine data sources, for example. Thirdly, we also have new estimates of unit costs which are already included in the unit cost manual and for which we have new data. For example, using BCIS data, buildings components data, the adult social care framework data, and that's just one of many examples, 2 of many examples. And lastly, unit costs which are estimated using relevant inflation indices. And these inflation indices are available in the appendix of the unit cost manual. So basically, we're updating the figures year on year where we don't have other data available. And there's a 10-year rule for this. So we can continue inflating costs from the original unit costs for up to 10 years. But after that, they become redundant. So they're omitted from the main documentation. Next slide, please. So really, figure 2 is perhaps what we're most all familiar with, which is the unit cost manual, which is available as a PDF online. Next slide, please. And so this is figure 3 illustrates the new unit cost adjuster, which is available in a Excel file. And Manu is going to talk us through that now. So without further ado, I'll pass to you. Thank you, Manu.
Okay, thank you, Helen. I'm going to share my screen now. Okay. So can everybody see it? Okay, so hello everyone, I'm Miyue Gao. I'm very pleased to have the opportunity to be part of the UniCoast project and to share some of the progress we have made so far. Today, I will be giving a live demonstration of how our UniCoast adjuster works. Please feel free to drop your questions in the chat during the demo or raise your hand to ask questions at the end. About the UniCoast adjuster. The UniCoast adjuster is developed entirely in Excel. This was a deliberate decision as our metadata and original cost calculations are already structured within Excel. Using this format simplifies linking and migrating data between sheets, minimizing compatibility issues. Excel also offers a significant advantage in its broad accessibility as well. It requires no coding skills, and most users are already familiar with its interface, making it more inclusive and practical for a diverse range of stakeholders. As a result, the data remain transparent and easy to use. The adjuster will be refined and updated annually alongside the menu, ensuring that cost estimates stay current and reflect the latest data and methodologies. So the adjuster consists of three main worksheet types. The first one is the front page, where users are introduced to the adjuster and the program background. The second one is the search directory, which helps users efficiently find the cost data they had. And finally, And finally, the schema and calculator worksheet, which is the core of the adjuster, where users can view and adjust the inputs to generate tailored unit costs. Let me now walk you through each of these sections in the live demo. So let's start with the front page, which serves as the entry point to the entire unit cost adjuster. At the top, we provide an introduction to the unit cost of health and social care program, which lasts from 2022 to 2027. This explains the background of the collaboration between the University of Kent and the University of York, funded by NIHR, and the goal of producing updated, publicly available unit costs. Below that, we introduce the concept of the unit cost adjuster, a new development in this 5-year program aimed at making the unit cost menu more accessible and flexible for different users. On the right-hand side, there are links to related websites, including the Unicost program homepage and the most recent Unicost menu, so users can quickly access the source materials. Finally, in the bottom right corner, we include a brief user instruction. With just 3 simple steps, you will be able to identify the Unicost you need. Now let's move on to the search directory, which is designed to help users quickly locate the unit cost calculators they are looking for. At the top, there is an input area where users can enter keywords. Always remember to use broad terms to keep the search broad. In the middle, we have the directory, which lists the titles of services included in the unit cost menu. And on the right-hand side is a clickable column, which showing the worksheet names. Each entry corresponds to a worksheet containing a detailed calculator. When users click on one of these names, they are taken directly to the relevant schema tab. The numbers in front of these directory entries correspond to chapters in the menu, especially useful when surveys have more background information in text. This layout is very intuitive. Just type the keyword, browse the service list, and click to view the calculator. For example, we would like to have the unit costs per GP consultation. Let's input GP in the search area. The first one is about GP practice-based nurse. Know what we want. The second one is a related one. Then let's click the link. So now we come to the related schema and calculator worksheet. This is the core of the adjuster, the schema and calculator section. On the left, we present the schema. This is based on the structure and format provided in the original unit cost menu. It includes the cost components, unit types, and the default unit costs. Maintaining this familiar layout allows users to easily compare and reference against the published menu. On the right, we have a dedicated calculator panel, which is fully interactive. We deliberately kept the schema and the calculator in separate areas. This way, no matter what values the user inputs, the original defaults are always visible for reference. The goal is to strike a balance between transparency, flexibility, and usability, letting users explore how cost components come together while preserving the integrity of the published estimates. Let's now take a closer look at how the calculator works. It offers several interactive features designed to make cost estimation more flexible and user-friendly. First, users can click the home icon to return to the search directory if they want to look up another service. Second, the checkboxes here allows users to include or exclude certain components. If you untick a box, the cost will be excluded from the calculation, making it easy to test the different cost structures. And here is the value column, displays the default cost taken directly from the Unicost menu. Users can also input alternative values in the override column to explore different assumptions. For example, if a qualification fee is more expensive, here is 49,000, but we have 54,000 in our own setting. Then we just override it, and the unit cost will be adjusted accordingly. If you would like to revert to the original default, simply delete your entry. In the unit setting section, users can customize the resource use as well, like the working hours per year, time per consultation last fall. And finally, at the bottom, users can select the output unit, such as annual, month, week, or hour, etc. Yeah. So, for example, if I want the unit cost of a face-to-face consultation lasting 15 minutes, the calculator will provide a customized cost accordingly. So first, I need to override the minutes for the average time per consultation last for, and then I set the unit setting to per consultation and have the face-to-face multiplier applied on. Then we got the unit cost we want. This flexibility allows users to tailor the output to their intended use or reporting needs. This is the whole process of how we get a customized unit cost. Because the following sections involve multiple schema and calculators, I'm going to show that using slides. Now let's talk a bit more about the unit setting, which is relevant to the resource use in health economics. For services like residential care that run every day of the year, the occupation time is usually 365.25 days, accounting for leap years. But for workforce-based unit costs, like a doctor, nurse, or social worker, we use working time per year, such as 43.6 working weeks or 37.5 working hours per year. This distinction helps ensure costs are calculated using appropriate units of resource use. We have also added a range of drop-down menus, so users can customize the calculator more flexibly based on the specific service they are looking at. For instance, you might want to calculate the unit cost of residential care for different age groups, such as the 18 to 64 age group or the 65 and over age group. Or maybe the cost changes based on the staff band, say band 5 or band 6 nurses, which affects wages. You can also change the units of costing, whether it's per client hour, per patient attendance, per week, or annually. And for surveys that vary by contact type, you can even apply a face-to-face or non-face-to-face multiplier. All these options make the adjuster flexible and responsive to real-world variations, because as we all know, not all services are delivered the same way. Thank you very much for your attention. I hope today's demonstration has helped you understand the structure, purpose, and flexibility of the Unicost adjuster. We are continuing to refine the tool based on feedback and user needs. So if you have any questions, suggestions, or thoughts, We would love to hear them either now or after the session. Thanks again, and our team are happy to take any questions. I will stop sharing the screen.